of being in closed rooms while the Democratic caucus has discussed health care reform. And I only wish you could be there to watch Betty McCollum fight for your right to have true reform on health care. Betty's been fighting behind the door. Betty's been fighting in front of the door. Betty's been fighting and listening wherever she can have an audience to hear her. And I want you to know that you all here today, you all are the activists. You are the people who really care. You are informed and you know what you're talking about. If you will not get out there and sell reform to the American people, no one will. Right. Don't look anywhere. Don't look left. Don't look right. Look in the mirror to be able to tell the American people that the time for health care reform is now. Right now. Not later. Not later. You all know that every debate has a rhythm to it. First of all, you get out there and say what you have to say. Then the people who are trying to stop you, they throw some stuff up on the wall, hoping to slow you down, right? But then the truth begins to emerge. Then the truth begins to come out. Then we begin to find out really is what and what is not what. And we are finding now that there's no death panels in the bill. That these are lies designed to confuse and misinform. And shame on them. That's right. If you have ever, and this is serious, folks, if you have ever been in an unfortunate position, and I know many of you have been, of having to decide what to do when a loved one can't make decisions for him or herself. You and I know that we would love to be able to know what they wanted. So what is wrong with a doctor saying when they are feeling strong, when they can make decisions, hey, you know what? What are your wishes? It's about dignity. It's about respect. It's about treating our loved ones with the respect that they deserve. And we're not going to let somebody turn this good provision into something bad. We won't do it. Let me tell you, of course they got out there and attacked the public option. Do you think that these people who've been making gazillions of dollars off of denying you and me care are going to give it up without a fight? No! Of course, but when the tough gets going, the good tough. And this is the time for you and I to keep it up, to keep the fight up, to not let down and to keep up the heat. This is the time to dig down deep. This is the time to figure out what's in you and what are you made of. Right. Don't you know that there was a 1957 Civil Rights Act? Did you know that? Yeah. Well, you know, a lot of people didn't know. We all know about the 64 Act, a great one that history has recognized. But there were steps before then. And we had to continue, we had to fight even in the dark wilderness during the days when we were fighting for civil rights in order to get to that day when we can declare that we're all Americans, free and equal, and brothers and sisters of each other.
That's right.
Now we are in that point where we are in the battle. We are in that point before victory has come. And the people who are stalwart and who are strong and who have a heart of gold are going to be the ones to carry the day. And that is you. That's you. That is you. I want you to tell those people who attack the public option that the public option, according to the CBO, will save $150 billion for people's health care costs. That's what the numbers say. You tell them about that. You tell them that if you want to cut health care costs, you've got to have a public option. And we will not settle for anything less. Some of us, many of us, said we wanted single-payer health care on Job 676. You to know that we've done all the compromising we're going to do. The line has been drawn in the sand, and we will not abide a bill without a public option. That's a fact. I want you to know that well over 60 Democrats have come back and said, we have roared back and said, no, we insist upon a public option. And we're going to insist upon it. to cut costs. This is the only way to drive costs down. This is the way to set a standard of care that provides for the best care over time. And we're going to stick to it. Now, I want you to talk to your friends, because some of them might think, well, Keith, even if we pass a bill without a public option, it'll still be a step forward. I want you to explain to them that getting rid of the public option is not going to get Rush Limbaugh on your side. Getting rid of the public option is not going to get Senator DeMint, who said that defeating health care was going to be Obama's Waterloo. It's not going to get him on your side. I want you to know that it's not an element of reform that they object to. It is reform itself. So look, stiffen up your back. Get your shoes ready. Knock on your door. Twitter, right? Facebook, right? Do what you do to get the word out to all of your friends. The time for people being denied because of a pre-existing condition is almost over. The time for 46 million Americans to go to bed tonight with nothing but the emergency room to help them, those days are almost over. The time for you to say, I can't get that procedure now, I'm going to have to put it off as I get sicker and sicker and sicker. Those days are coming to a close. Because you and I we have grasped the magnitude of this historic moment that we are in right now.
That's right.
We have grasped the enormity of the change that is right within our hands. We know how important this moment is right now. And we are not going to back down, and we are not going to punk out, and we are going to get the reform that we deserve. So get out there and fight and stand up for it. Believe in it. It's almost there. It's almost within your reach.